89.9 KMOJ FM and KMOJ HD1 Minneapolis, St. Paul. Bringing unity to the community. 89.9 KMOJ, the People's Station.
89.9 KMOJ. It's Glam Life. Kim here. Right now it's 2 after the 1 o'clock hour. And it is time for Minneapolis 360 with one of my favoriteest people in Minnesota, Mr. Anthony Taylor. Anthony, how are you today?
Kim, I feel great, and I'm gonna tell you why. And I kind of told you before, we talked a little bit before we got on the show, right? So, Minneapolis, welcome. I'll be brief because there's a lot of stuff I want to get to, but my name's Anthony Taylor. I'm the African American Community Specialist for the city of Minneapolis, and I want to say the reason why I'm feeling good, right? So, Kim, and I told you, and just real quick. You know, I was working out this morning in Minneapolis. I downloaded one of my favorite artists' new album, and it's Nas, right? So it's Nas. He's got a new album called King Disease 2, and I'm listening to the music. Kim, Lauryn Hill was on a track with him, and her verse was so cold. It just made me realize how much I miss hearing her,
Her voice, I swear I love Lauryn.
Everybody loves it. It's almost like your favorite cousin you ain't seen in a while. You just want to hug her, right? So, and it just made my day feel great. So, Minneapolis, if you got a chance, you know I'm not getting paid by Nas, but listen to listen to King's Disease, called a track called Nobody with Lauryn Hill. It just made me feel some type of way.
Oh, so I can't wait to go listen.
Gotta listen to it. And Minneapolis, welcome. This is Minneapolis 360. Always my pleasure to be with you every second and fourth Wednesday of the month, talking to you today about different type of issues and topics. And this is what I'll do. I'm going to save the updates for later, right? Because I think this is an important topic. And the topic is Minneapolis is alternatives to police responses, right? So again, alternatives to police response. And I really want to encourage folks to call in and ask questions to my two guests that'll be on this show, and I'll introduce them in a bit. But what's important to know about this Minneapolis and this program that the city of Minneapolis is attempting to do is to have folks who are in situations that they can respond to crises, and specifically mental health crisis, right? And I think we have these all the time in our community. You may have called police when you've had a mental health crisis. You may know someone who's had a mental health crisis. And what happens is police show up. Well, this program, and I'll have these two folks come on and talk about it here real soon, is providing the right people to come to those responses when we need someone to help, right? We need somebody in a lot of those situations that require empathy. We need folks in these situations to treat people as human beings, right? And we also want folks to treat people like we want to be treated. Like a lot of times police come at our worst moments, right? And they are not always the people who are qualified and trained to help in these situations. So this program, I think, is an important. And again, Minneapolis, I want folks to call in, ask questions. We got a 30-minute show, so we're going to try to jam-pack a lot of information in, but I love when people call, right? So again, Minneapolis, the topic for today is alternatives to police response. And I've got two brilliant people from the Office of Performance and Innovation coming on. I have Gina Allen, Program Manager, and I have Director, one of my favorite people in the city, Brian Smith, on our show. And folks, welcome to Minneapolis 360.
I was going to say real quick, too, before you bring them on, I want to give them that number. To call in, the number is 612-377-3456. Again, that's 612-377-3456. All right, I apologize, Anthony. Give them that great introduction again.
No, hey, listen, give them that number because that's important. Family, welcome. How you doing today?
Doing well, Anthony. How you doing, bro?
Good. Gina, are you there?
I'm there, Anthony. Fun to be on the line with you today.
Thank y'all, too, for showing up today. I really appreciate it. I want to get right to it. Again, callers, please, if you have some questions, the number is 612-377-3456. Gina, I'll start with you. Kind of introduce yourself to the city and tell us what you do for the Office of Performance and Innovation.
Yes, thank you, Anthony. Like you said, I'm a program manager in the Office of Performance and Innovation. I'm also a North Minneapolis resident, so this work is really close to my heart. And our team works to really enhance the quality of life for residents by improving city service delivery, and that's why we're working on this project that we'll be talking about. We also manage the performance bar departments to make sure those services really are serving residents in the best way, and to figure out where we might be able to, kind of tweak those and make those just easier for residents to use. And much of what I'm working on right now is about figuring out which 911 calls could benefit from a response without police, and then developing and implementing pathways to make that happen. And we'll be talking more about that today.
Thank you. Brother Brian, how you doing?
I'm doing all right, sir. How are you?
I'm good, brother. Let the people know what you do at the Office of Performance and Innovation.
Well, Gina summed up most of what we do, but my role is the director of the Office of Performance and Innovation, and so I get to work with a team of folks who do all the work that Gina just mentioned, and more importantly, create avenues in the city so that we can actually manage performance across all departments, set real good metrics, and place those things in the public sphere so people can really know what services, as residents, what services their taxes are paying for, what they should expect for them. And that way they can, take a look at what's going well, what needs to be improved, and things like that. And we also do a lot of work with community folks, because everything that we do and everything that we build as an innovation team, we always co-build. And so we set up an atmosphere where we work with city staff, we work with residents, so that anything that we do is co-built based on what the residents say they need and the ability of staff to deliver that in the city. So our work is fun, it's never monotonous. We get to work on different things all the time. We get to be in everybody's business to a degree in all 22 departments at the city and almost 300 program areas. But it's all about making sure that we can deliver quality service to the residents of Minneapolis that pay our salaries down there.
Appreciate that, Brian. So Gina, let's get straight to it. Explain to folks what exactly, why is this work important, alternatives to police response? Why is that important, Gina?
That's a great question, Anthony. So our alternatives to police response work is really centered around the idea that police do not need to and really shouldn't be responding to all types of the wide variety of incidents that they currently do. So with this in mind, we're really working to create and integrate additional service options into the existing public safety system to address certain nonviolent issues that have, traditionally been handled by law enforcement. And we want this to help ensure that Minneapolis community members are getting the support that best fits their needs, and also to help free up officer time to respond to emergent issues that are most directly in line with their training, skill set, and resources. We know that there are certain circumstances where it may take a little bit longer to get an officer response, and so we do want to make sure that we're being mindful of which calls could benefit from different responders showing up, and then free up that time for officers. And then the programs and services that we're piloting, we looked at a lot of data to kind of gain our footing and start developing these. So that is like internal city data from our community-based partners, national statistics, research about what is working or not working in other places. And we continue to have ongoing conversations with similar programs that exist across our nation, mental health experts in our city, our 911 staff, officers, and others who will be working with this new set of responders. And as Brian was mentioning earlier, all of this has been co-created with our Minneapolis community members through surveys and interactive workshops. And we did that because we really wanted to understand how these issues impact folks, and then explore ideas that communities said they wanted, which led us to the pilots that we're working on now.
So, and Gina, I'm going to ask
one other thing. Oh, sorry.
No, go ahead.
Well, there was one other thing I wanted to add to that, and that was something I think it's important to acknowledge is that throughout this process, we learned from those surveys and workshops that many Minneapolis community members have had negative interactions with police, especially our Black, Indigenous, and queer, neighbors. And by diversifying how we respond to 911 calls, we have a chance to really reduce those negative experiences and start to mend the relationship between the city and residents.
And that was my question, and I'm glad that you brought that up, because I wanted to ask you, what are some of the narratives out of all of that, when you examine all of that data, what did that tell you? And obviously, being specific to Minneapolis, we're talking about folks of color, our indigenous and our queer folks that identify that way, that this is the group that's affected the most. So I'm glad you brought that up. And Brian, I want to ask you this, and again, Minneapolis, we're with Gina Allen and Brian Smith from the Office of Performance and Innovation. Talk more about these new response programs, Brian, that are happening, that you're working on for 2021.
Okay. Gladly. First, I want people to know that this work began in earnest 2 years ago. And so I do want people to know that although our team is always ready to respond to anything that's going on in the city and respond to what community needs, that the work to create these alternatives was something that happened well before COVID and well before our brother George Floyd was killed by Minneapolis police. And so this was some forward-thinking things by city council, by city leadership, and by community members, that this is all a result of those conversations happening well before that. And so with that said, the things that we have been working on and that are rolling out now, some which is currently happening, some which is still on the way, is number one, the mobile mental health teams, the mobile behavioral health crisis response teams. And so we are in the process of finalizing these teams and signing contracts and getting trainings done so that the residents of Minneapolis can have a 24/7 mobile behavioral health crisis response team, always on the streets and ready to respond to a behavioral health crisis when appropriate. And so that's underway now. And we call it a pilot, although it's funded ongoing. We call it a pilot because it's new. We'll be learning throughout the process, and as we learn, we'll tweak and continue to iterate on that program to make sure that it's meeting the needs of the residents of Minneapolis. We're in the process of doing a 911 training for all dispatchers in our 911 center. So around assessing mental health calls, they're already really good at what they do and do a great job now, but we want to make sure that they're trained by mental health professionals to really be able to triage and assess what's a real mental health call and what may not be, so that we can make sure that we're sending people to the appropriate calls. We're also working on embedding mental health professionals inside of 911. So aside from that training, we also want to embed mental health professionals in 911 that will be there on every shift, so that if they're still, even after they're trained, if they still have some additional questions, you have somebody down there who can be on that call with them, help them through that process to make the proper decisions about who to dispatch, when and why or how. We're also training non-city staff to take theft and report only calls, damage report only calls, and collecting evidence. That was something that was typically handled by the police. And again, like Gina spoke to earlier, when you have people who have an expectation that if my bike is stolen, a police officer shows up, or if there's damage to my car, a police officer shows up, or if I want somebody to collect some evidence, this is things that people call the police for. Police go to them, and while they're spending time at those calls, they aren't able to respond to those things that are most urgent, that they're equipped to take care of. And so what we're doing is training city staff right now to be able to do those things and free police officers up, and then have a different type of presence responding to those things as well. We've transferred all report and nonviolent calls from 911 to 311. So those calls will be handled by 311, and people can also make online reports as well, and those things will be followed up on. And so we don't need MPD going out to take those reports. And the last thing that we're doing, well, not the last thing, there's some other things that we're doing too, but the last thing I'll mention is we've also added capacity to our regulatory services department so that traffic control can handle overnight parking violations. They usually do it during the day, and then in the evening hours, MPD responds to those. And so we're freeing up MPD once again with an alternative response by giving traffic control the capacity to do overnight shifts on parking violations as well, so that we don't have Minneapolis police officers showing up to those things.
And I think that's great information, Brian, and it's so many layers to that. And I know we only have a half-hour show, which makes this conversation a little bit interesting and kind of challenging at the same time. And one of the challenges I think that we face, at least on this show, and when you do it remotely, is that when we have two guests on the line, we aren't able to take callers. So Minneapolis, if you're out there and you've been calling and you can't get through, apologies to that. What I will do is make sure that you have the contact information to the Office of Performance and Innovation and any other numbers that you need if you're calling in now, because it's such an important topic. And just the bars that Brian dropped on this is a lot of depth in that. But what I do want to do is kind of transition to Gina, right? So, Gina, what's kind of the timeline for these programs to start?
Yeah. So the service that Brian mentioned of non-police city employees at 311, taking those non-violent, non-emergency theft and property damage reports, that began last month. And this is, again, instead of 911 dispatching Minneapolis police officers. So instead of that in-person response, it's taking up, potentially a good amount of time, that those calls, since they're not actively happening, can go straight to 311, or residents can go, again, online and report those. And then as for those mobile behavioral crisis response teams, our plan is for those to begin next month. We are still getting folks hired and trained and all of those things together, so that's a little bit tentative. And for traffic control to start taking those overnight parking violations, we're again hoping that happens within the next month or so. And then those other pilot programs, such as 911 staff being trained to assess mental health calls and embedding that mental health professional in 911, we're planning for those to begin sometime in the fall.
We are with Gina Allen, Brian Smith, Office of Performance and Innovation. So now, Brian, how should I report a property theft to the city now instead of calling 911?
So there's two ways that you can do that. You can call 311 directly, and we know that takes some time because people are accustomed to calling 911 for almost everything. I mean, when we were kids, the first thing your parents tell you is, there's a problem, call 911. But, we can call 311 directly now for those things. And you can also submit an online report by going to the city's website. I can state that for you. It's not very long, but you can go to www.minneapolismn.gov. And once you get there, you click on File a Police Report, and you can file your report there and get follow-up through the city of Minneapolis.
Gina, so, and appreciate that, Brian.
I'm sorry, Anthony. Sorry, I should probably give you a little more information too, and that is that so that people have all the information, that Minneapolis 311 takes calls from 7 a.m. to 7 p.m. Monday through Friday. But you'll need to call between 8 a.m. and 5:30 to make a theft or property damage report. If you need to make a report outside of those hours, you always can, and that's by reaching the website and file a police report, and people will get back to you within 3 business days. I just wanted to give that level of detail. But again, the quickest way to generate a case number, because it happens automatically, is if you go online and fill out the report, as opposed to having to wait over those weekend hours. If somebody just likes to talk to a person, the same thing is going to happen. If you fill out that online report yourself, it generates a number. Or if you wait over the weekend and wait to call in on Monday, the exact same thing will happen. So we would encourage people, if they can, to fill out that online report and generate that file number as soon as possible, as opposed to waiting when the 311 office is down or over the weekends.
We are talking with Gina Allen and Brian Smith. Gina, so talk to us about the timeline when these pilot programs. Oh, you did that already too, so I'm glad you said that. I'm getting texts from folks saying that we're having some technical difficulties and folks can't hear. So Kim, I don't know if you can look into that and see if there's an issue. I think I got a text that said it was dead air.
Oh, okay. I'll check into it. I still say let's keep going. I'll still check into it at the same time and see if we are online or not.
Okay. So Gina, tell us about the mental health crisis. Once that is up and running, how can folks get in contact with that?
That's a great question, Anthony. So right now, if anyone is experiencing a mental health crisis or behavioral health crisis in Minneapolis, you can continue to call 911. Police and or EMS will still be the response right now before those teams are launched. Folks can also call the COPE Mobile Crisis Team in Hennepin County. And for adults in Hennepin County, that number is 612-596-1223. And for children 17 and under in Hennepin County, the number is 612-348-2233.
Oh, you think on the app or something?
And then once those behavioral health crisis teams do launch, if you are having a mental health or behavioral health crisis, again, in Minneapolis, still call 911, and those teams will be dispatched to eligible calls, which will be things like firearms, which police have to go to if a firearm is involved. As well as those calls do need to be nonviolent, and then a number of other criteria, but they'll be dispatched by 911 dispatchers. And this was a really important feature we wanted to include in this program because, as Brian mentioned, we all know to call 911 when we're having a crisis or emergency, so we didn't want to have a new number for residents to have to remember. So no one has to change how they already request support in a crisis. And one thing I do want to note is that it is possible that not all mental or behavioral health crisis calls will receive that mobile behavioral health crisis team response right away. Again, calls that involve a firearm or violence, those will still receive a police response. And also because this is a pilot, we're working on figuring out the right number of vans we need across the city to ensure that we're able to meet the demand for those calls.
We are with Gina Smith, or Gina Allen, Brian Smith, and Gina. I think this is one of the most important aspects of this as we run up against the clock. What I do want to do is real quickly talk about this, right? So when you selected these vendors for this mobile behavioral health pilot, tell us about them, because I think that's important, because a lot of times folks want to know, who are these people, right? So just kind of tell us the selection process and the vetting process for these folks with the behavioral health pilot.
Gina's real quiet right now because she didn't want to do 2 questions in a row. So I'm going to hop in and do that one. That's a good question, Anthony. And I think it's important for people to understand how we made the decision that we made. Because, sometimes inaccurate information can be out there and people make all sorts of accusations, but I want to let people know. I think this is an important question so that people can understand our process. As we went through this work for a couple of years and working with community members, internal people to the city, which included police, 911, fire, Civil Rights Department, a whole host of folks, along with community members, which were, your normal everyday community member who's not a mental health professional, but who've had members of their families who've experienced mental health crisis. Some people may have experienced it themselves. We had people from EMS in Hennepin County, had people of their psychiatry departments, had people of this psychological department. So we had a whole host of people involved in this decision-making process who scoped out questions with us, talked about what it is we want to do, how we want to do it, and they were also a part of helping us draft the RFP questions. And also, once we got people to respond to the RFPs, they were a part of the interview process. So this was not done in a vacuum in some back room in City Hall. We practice what we preach, which you're rather familiar with, unlike maybe most people, but you're familiar with it because you've been around our work. And so those are all the people who are part of the decision-making process when it came to choosing a vendor. And so after we went through that process and everybody gave their input, Canopy, Mental Health, and Consulting were the chosen vendor based on everybody that I mentioned who were part of that interview process. That's who everybody landed on. And Canopy is made up of a bunch of mental health providers who are quite experienced, but Canopy came together as an established group in and of itself in January of 2020 with the vision of centering the experiences of and mental health needs of BIPOC and other historically underrepresented communities. And so Canopy is also a majority Black-owned business committing to providing person-centered, high-quality mental health services to diverse communities in the Twin Cities. And in saying that, of course, they also serve white residents as well. So they have a very diverse group of therapists that they're working, and the approach that they bring to their work is the same approach that they're bringing to hiring these new crisis workers that will be in our communities, because they understand the importance of being able to serve the diverse demographics that we have within our city. They were actually established, their establishment actually coincided with both the beginning of the COVID pandemic and the unrest following George Floyd's murder. And so they knew there were unique circumstances that we were dealing with in the Twin Cities based on George Floyd being killed and the COVID pandemic and just the strain that put on people and the mental and physical strain. And so they wanted to be able to respond to that in a very unique way. And so they formed Canopy, and they got on the streets and got into helping people right away, and created Canopy so that people could get the help that they needed on 38th Street and throughout the Twin Cities, and also set up sessions, just like you would a typical mental health provider and therapist. And they've been providing those services ever since. And when they responded to the RFP, the overwhelming majority of people that were part of the process chose them.
Brother Brian, Sister Gina, I appreciate y'all being on. Can I get a commitment from you to come back on the next show to talk about this? I really think we need to dive deeper. We may have had some technical difficulties. Is it possible that you would come on the next show and we can kind of talk about this more?
Scheduling permitting, we would do anything for you, Brother Anthony, and for KMOJ. So I'll make that commitment.
Okay.
I'm down too, Anthony.
I appreciate that, and I think we have to work it out where we can get some callers on. So we'll figure that out. But I appreciate both of you for coming on today and sharing this information and really committing to coming back. We'll have to find a time, because I want Minneapolis to be able to chime in on this too, because this is super important. There's so many details to dive in, and I want folks, and I know you guys absolutely do, want folks to be informed, especially with the work groups and the surveys that you guys have did to get this rolling. So I think this is really important. But for today, I really appreciate you both, man, and thank you very much.
Appreciate you and everything you do. Thanks for having us on.
Thank you. That's a lot of information,
It
Kim,
was.
that we didn't get a chance. And in Minneapolis, I want to apologize. We'll figure that out. We've got a half an hour show. It makes it a little bit different. So we'll figure that out. But we're going to have them come on again
and I'm
today.
not positive if it was because we were still on, so on the radio side. So I'm not sure if it was in the app or if it was there where they were at as far as traveling. So we'll get it figured out.
We'll figure it out. Yep. And again, Kim, always good to talk to you, sister.
Oh,
So
same here. I appreciate you. Keep doing
I
great things.
appreciate you too. Be well, Minneapolis.
All right, kings and queens. Coming up next, right now you got a little bit of Chris Brown with Go Crazy. And right after that, Zany K, Mr. Big Mouth himself. He's going to get you right this afternoon.